have to set the title of the stream. Hub stream. Okay. Welcome back to my channel, and I've been away for a while, so I was working on some things on my website, and this is what I've been working on. What I have here, this is I've made a question bank for our final year exams. So here's the list of topics, like the main subjects that you can choose from. So today I'm gonna try and review some discuss some MCQs in psychiatry for you guys to give you guys a preview of what I have made here. So here we have all the subtopics of psychiatry questions, and the ones that are grayed out, these are the ones that I haven't uploaded yet, but these ones are like properly working. So the ones I have uploaded, but it's just a matter of putting them in one place and like uploading them to a post and adding these images and all, like the post image. But yeah, but I made like a randomized question which has all the questions in psychiatry that I have processed. Like there's about the question bank has about more than 500 questions for psychiatry. So in the randomized one, it will choose 10 questions from that and give them to you randomly. So let's try some randomized questions from psychiatry. Even I don't know what I'm gonna get. I've never done these. I probably haven't done these before. I've tried out some MCQs. Yeah, so this is what you're gonna get. By the way, the randomized questions are only available for paid subscribers, and these other categories, each subtopic has 10 questions free for non-paid subscribers as well, but you have to log in either way to access these MCQs. So when you go here, you can see there's a button to go full screen. When I do my MCQs, I generally like to go full screen to avoid all the other distractions on the screen. So here's the full screen view, and I've kind of made it bigger so that people on smartphone devices and smaller devices can also see what's happening on the screen. So let's start these random MCQs and see what's to show you guys what I'm talking about. And here some questions have a hint. If the question is a bit difficult for you, there's a hint. Yeah, and this is a TTS thing. So if you want your question read out loud, it's basically a gimmick. But if you get bored, if you need some stimulation, if you get sleepy, you can just try that out.
A patient to whom fluoxetine 20 milligrams BD was started for the first episode of depression. What are the advice that should be given?
Fluoxetine, first episode of depression. So it is taken on an empty stomach. I'm not sure about that, but yeah. Yeah, I'm getting these notifications. Don't mind that. I'm trying to. Yeah, so on an empty stomach, fluoxetine, I'm not sure about that. Known to transiently increase anxiety. Yeah, that happens with SSRIs. Fluoxetine is an SSRI, so they tend to have immediately after you give the drug, acutely you can have anxiety, and suicidal ideations can also increase within the start of the course. So I'm going to put that as true. So what we need to do is, this is a true or false type question. And here I'm supposed to select the true statements. And if I select a statement that is false, I will get a negative mark. So -1. And if I choose the correct ones, I get a +1. So if I don't know something, I'm supposed to not select those. Otherwise, basically, like, you could select everything, and that could, like, it wouldn't have a negative effect, right? Yeah. So yeah. So if you select the wrong ones, you're supposed to get a negative mark. And but if you don't know something, you still have to leave it, and if it's false also, you still have to leave it. So that's not how it works in the real exam. But ideally, I should have two options to select true or false, but I'm only supposed to select the true ones. Sadly, I couldn't code that into this software, so you're gonna have to do with this for now. I mean, it's not ideal, but it works. It's not it's not an actual exam, right? This is just to study, to revise the topics. Yeah. So effects of treatment takes up to 2 weeks. Wait, my face is blocking the view, right? Let me put myself to the side. Treatment takes up to 2 weeks. That's true. So typically SSRIs, like, the depression doesn't go away, like, even the slightest effects. It takes up to 2 weeks to show, and if it works only, you increase the dose and titrate it. Yeah, so that is also true. It's continued for 6 months after remission of symptoms. Yeah, typically like a depressive episode lasts for about 6 months. So even if your symptoms symptoms go away after like 1 month, you have to continue the antidepressants for 6 months. And causes premature ejaculation. That is true for most SSRIs, so I'm gonna put that as true as well. Okay, not premature ejaculation. It causes delayed ejaculation, so I'm gonna leave that as false. This one I'm not sure, so I'm gonna leave that as empty as well. All right, I got them right. So these ones I left are false, and these ones are true. So it means correct. And once you do the question, if it turns green, that means you've got everything right in that question. So yeah, since I knew all of these, let's the first one. Incorrect. Fluoxetine can be taken with or without food. Taking it with food might help reduce the potential nausea for some. There is no strict requirements for an empty stomach. So another thing that you need to note about SSRIs is that these can cause drowsiness, and these can cause like insomnia, SSRIs. So it's been said that you need to take these in the morning and not at night. But I've been told that by psychiatrists in Sri Lanka that for Sri Lankans, it generally works better if you give it at night, although it's tolerated better when you give it at night. I'm not sure what the reason is. I'm not sure how the insomnia is being affected in that case. Anyways, let's move on to the next question. You can see my cursor right here. Let's sometimes it
2 regarding normal development in children.
Normal development. Isn't this a pediatric question? Separation anxiety is commonly seen in preschool children. I guess so. Even I cried when I was in preschool and my parents left me one day in the playground. Bedwetting is normal at 3 years of age. Generally, children are expected to achieve daytime dryness by the age of 2 years. I'm not sure about this. It's probably not a normal feature, like, expected to achieve dryness by this. But sometimes there are children who continue to have nocturnal enuresis, and you have to reassure them it goes away after a while. Walking is achieved by 18 months. That is true. They can walk. They have a stable gait by 18 months. Temper tantrums decrease by school entry. I'm not sure if that is true, but like, when children get temper tantrums, you're supposed to like ignore them. I think that's what you're supposed to do. peer influence plays a major role in early childhood. This one I doubt it's mostly the parents that have the most influence. I'm going to leave these as empty because I don't know. The first three I'm kind of sure of. Temper tantrums decrease by school entry. Interesting. And peer influence plays a major role in childhood is false. I knew that. Yeah. This is the only one I was not sure about. So this explains all the each MCQ stem is explained in the explanation. So and all the statements here, you are given a page number in the preferred textbook that we use for in our medical school. So the shorter Oxford textbook of psychiatry is what we use. So that's what I've put as the used as the reference book here. And so if you want to read more about any of these statements and that you're not sure of, you can simply just go to that book and just turn this page and it will have the answer. Like, whatever extra you need to learn about this. So yeah, what we're not sure about? The temper tantrums are common in toddlers 1 to 3 years and usually diminish as a language self-regulation skills improve. And as a language and self-regulation skills improve, the textbook. The short of Oxford textbook says temper tantrums continue but diminish and should disappear before the child starts school. So it says temper tantrums decrease by school entry. That means by the age of school entry, not by putting them in a school is what they took the statement as, I guess. Yeah, let's go to the next one. Delirium. Common in elderly than young. Yeah, that is true. It usually happens in elderly people when they have like an organic disease going on, associated with hyperpyrexia. True. When they have like a fever, they can get delirium. Elderly people should be treated with antipsychotics for at least 6 months. That I'm not sure, if the delirium is because of a organic pathology, that pathology has to be treated and the delirium will go away. But if the delirium is if it's due to a psychiatric illness, it wouldn't be called delirium. So yeah, I think this one is supposed to be false. You don't treat them with antipsychotics, you treat the underlying cause and should be treated in ICU setting. This I think I might take as true depending on the underlying pathology. So if they're having, the only thing they're having is delirium, you don't need ICU treatment. If they're having like meningitis or something, maybe meningoencephalitis, then yes, there might be a place for ICU admission. But if it's delirium tremens or whatever, it can be managed in ward. So I'm going to leave this as false as well. I keep getting these right. Correct. Well done. I need to change the colors of these. Like green color when it's correct. Yeah. Well, delirium is common in ICU. So people in ICUs can get delirium, but doesn't mean you have to put a patient into an ICU because they get delirium. Yeah. Let me put a noise gate to this filter. Enough. I think this is associated with okay, we did this. Go to the next one. I have to press it again. Sometimes you have to press
For
twice.
a 15-year-old boy was scolded by a teacher in front of the entire class. He was feeling sad, had poor sleep and refused to go to school for 3 days, following which he was counseled 3 times, allowing him to completely recover and get back to his normal activities. What is the most likely condition described here?
A 15-year-old boy, he was feeling sad and poor sleep and refused to go to school for 3 days, following which he was counseled 3 times, allowing him to completely recover. Folded in front of the class. So just 3 days. So you can't call it a depressive episode. I think it's mostly an acute stress reaction. School refusal due to acute stress reaction. Yeah, here this is actually a SBA, like a single best answer question from the question stem. You can tell. Only supposed to select one, but it has given it as a true or false, but probably the other answers are given as false. Yeah, acute stress reaction, normal reaction, both are given. Yeah, consider the duration, severity, and functional impairment. Yeah, why did it select normal stress reaction? Correct. Even the common adolescent experience of a sensitivity to public embarrassment, a brief period of sadness, sleep disturbance, and school avoidance lasting only 3 days, solving completely with minimal intervention, could be considered within the range of normal, albeit strong. I mean, the answer is the first one, obviously. I took it as I didn't get all of these right. So yeah, if you have an issue with a question, if it's wrong, or like, if you feel like there's something needs to be fixed in the question, you can go to the bottom. There's a window to, to report the question at the bottom. So when you click that, it asks you what's wrong with the question. So I can say it's an SBA. So when you report these questions, me or somebody not moderating our website can go and manually change these questions. So the more people use my website, the more people use these questions. The question bank kind of self corrects itself with your help. So I want you guys to go and do more of these questions. That's why I've given a lot of them out for free. Like nearly, I think more than 25% of my entire question bank is available for free. So you just have to submit this, and sometimes it doesn't work. Okay, it worked this time, luckily. Yeah, let's go to the next question. A 60-year-old male presented to the hospital with pneumonia. He has diabetes, non-alcoholic cirrhosis, renal impairment. During the first night at the hospital, he is observed to be noisy, disoriented, argumentative, and disturbing other patients. What is the medication of choice to manage his behavior? So he has a pneumonia, has diabetes, has non-alcoholic cirrhosis, renal impairment. So he's agitated, basically. Disoriented, agitated. So the patient could be in delirium is what I'm gathering from this. What is the medication of choice to manage his behavior? So if you don't know the pathology of the patient, if it's a agitated patient who is not psychotic, first choice is to give them benzodiazepine. So if I get a patient like this in a medical ward, I would try to verbally de-escalate, and then that doesn't work, oral diazepam. That oral, if you can't give oral, then I will give an IM midazolam maybe. So I'm just gonna put diazepam as the answer and see what it is. Because it could be delirium tremens. In that case, you should give chlordiazepam oxide, but it has no mention of the patient using alcohol. So I will go with diazepam, haloperidol. Okay, they are asking about the rapid tranquilization, but what I thought was that you don't give haloperidol if the patient is not a psychotic patient. Agitation in delirium. So yeah. Likely precipitated by pneumonia. That's why I thought, yeah, it is a delirium. Multiple comorbidities. Yes, okay. I think where I went wrong was this patient has cirrhosis. So you can't give a diazepam because the patient is in liver, like in cirrhosis. So his liver functions are impaired. So that is why this was not the option. And also chlordiazepam oxide would be the better option in that case, maybe. It's a bit shorter acting than diazepam, because it is a prolonged sedative. I guess that's why I went wrong. Low dose haloperidol. First line for agent for agitation in delirium when medication is needed. Low risk of sedation and hypotension compared to other antipsychotics. However, it carries a risk of extrapyramidal side effects. This is the first generation antipsychotic, right? Lowest effective dose. I think 3 to 6 milligram is the dose for oral haloperidol in rapid tranquilization. Yeah. First line, so yeah. And it says it's the first line as well. So I guess that is the correct answer. We have 5 more questions to go. A 42-year-old farmer had attempted suicide after a crop failure. Crop failure? Maybe he was he's a farmer and his crops died or something. Yeah, he's attached to his crops a bit too much. In order to help him, which of the following should received priority? There's something wrong with the grammar. So the following should receive priority. Help him to get his cultivation on track. So yeah, he was probably in a bad financial situation, and yeah, I understand what the situation is, but like the primary problem is the suicide, and we need to address this and do a risk assessment. This is what I would do if I come across a patient like this, if he goes back and tries to commit suicide again. And yeah, so if it's like most people, most people are attempting suicide because of their impulsivity and not due to like an underlying depression per se. People are just impulsive. That's most times that is the underlying cause for these suicide attempts. So they don't really want to die. They just have the idea and they just do it. So yeah, this would be my first thing to do. Yeah, I think so. And that determines the rest of his management as well. Depending on if he's high risk, we have to admit him and treat. Which of the following are common side effects of clozapine? Decayed blood dyscrasia, yes. Myocarditis, yes. Hypersalivation. Okay, some antipsychotics have dryness of the mouth. I think lithium had dry mouth. that's not an antipsychotic, it's an mood stabilizer, but it's so hard to remember these side effects of drugs. I'm gonna leave the hypersalivation one out for now, because I remember some antipsychotics also had dry mouth. Not sure though. Pulmonary embolism, not really seen, I think. These two are the main problems. Sedation is definitely there, common for most antipsychotics, almost all. This is a first generation one as well, I think. I'm not sure. Pulmonary embolism. Maybe I'll put hypersalivation as well. Pulmonary embolism, maybe not. Let's check. Oh, they're asking common side effects. Damn it. Oh, agranulocytosis and myocarditis are like, major, like, how do you say, concerning but rare side effects of clozapine. So they are not common. This is where I went wrong. Should read the question stem properly, I guess. Incorrect as a common. Yeah, that's where I went wrong. Hypersalivation, yes. Siluria is there. I got that one right, finally. Pulmonary was incorrect. While there's an increased risk of venous thromboembolism with antipsychotics, including clozapine, it's not a common side effect. Sedation is a very common side effect. Regarding depression, occur in late adolescence. Yeah, depression is very common in adolescence. I read this one article done by a professor in our department, a meta-analysis, and it said that like in Sri Lanka, the adolescent depression is like more than 20% or something, like, basically 1 in 5 people. I think it was 20% of, something around that. Yeah. And that is like very high compared to depression in like adolescent depression in other countries too. Very concerning actually. Late adolescence, early adolescence, any part of adolescence, yes. Associated with epilepsy. No. False. I am not aware of a association like that. Multiple sclerosis is a risk factor. But any chronic disease can have depression as a comorbidity. Multiple sclerosis, I'm going to go with that. It's an autoimmune connective tissue disorders are generally associated with depression. Following, like, SLE can coexist with, because following Parkinson's disease, true. My grandfather also had this. Occurs following a stroke. I think, yeah, there's a association as well. Yep, this one I'm not sure. I'm gonna leave it, but the other ones are definitely true. Okay, yes, one is also true. Surgery with epilepsy, correct. Depression is a common comorbidity in individuals with epilepsy. Handbook of Clinical Psychiatrists. I've been told by professors in my department, psychiatry department, that we shouldn't use this as a reference textbook, but it's very useful and comes in handy to study. I mean, maybe not everything that is 100% up to date, but I mean, for our level, for most people, it's very useful unless you are trying to go for a distinction and get everything right. Yeah, they would lose their mind if they saw me using this as a reference. Actually, I'm going to redo this these questions sometime in the future and adjust this, and I'm going to use a different clinical book as a reference. I have to talk to people and find a better book to reference. Physical illness is associated with depression. Yeah, yes, as an illness associated. Next, we have 2 more questions left. The following are negative symptoms of schizophrenia. Alogia. Okay, they had like a symptoms of schizophrenia. They had a few that starts with A. Asia. A. I don't remember. They all started with A. Blunt eyes. Blunted affect is there. Formal thought disorder is not a negative symptom. Axi flexibility is akathisia. That's there. It's akathisia or something. Disorganized behavior. I'm not sure. Alogia might be. Let's check. Damn it. Flexibility is seen in like severe depression as well. Alogia, correct. Refers to poverty of speech. Yes, alogia. It's a negative symptom. Disorganized behavior, incorrect. Firstly, disorganized or catatonic behavior is considered a positive symptom. Blunted defect, true. Formal thought disorder, the positive symptom. Axis flexibility, incorrect. Axis flexibility is catatonic motor sign. Part of disorganized behavior, not a negative symptom. Interesting. Yeah. Go to the next one. Last question. Neuropathological changes in Alzheimer's dementia includes reduced levels of acetylcholine. Neuropathological changes in Alzheimer's. Reduced levels of acetylcholine, maybe. I think I've heard something like that. I'm not sure. I haven't read much on Alzheimer's. Selective decrease in cholinergic neurons. But are these supposed to be one stem? Amyloid plaques. I think there was some plaques in Alzheimer's. I'm not sure what. Decreased size of lateral ventricles. Usually the ventricle sizes increase because of the atrophy of the brain parenchyma. So this is false. Accumulation of neurofibrillary tangles. I think this is also a pathological feature. Because they're in some kind of disease like either Parkinson's or Alzheimer's. I'm not sure. Acetylcholine. Let's check. I just missed one. Selective decrease in cholinergic neurons, delusional disorder. There are like two stems basically. First part is correct. It says there is a, okay, I need to fix this question as well. There is a relative selective loss of cholinergic neurons, particularly in the nucleus basalis of the myonate. What the hell is this? Let's search what that is. Myonate. Okay. I need to report this question as well. MP. Can just tell what's wrong with the question, and I can, or whoever's doing this can check from the back end and fix these questions. Yeah, okay. So we finished all the questions and I got 3 of them completely right and some of them partially correct. I didn't get anything like completely wrong. So let's go ahead and see the result. Neurofibrillary transfer, intraneuronal fibrillary triangles composite. Yeah. So when you are doing these questions, you can read all of them separately, or you can just pause and read them, I guess. Let's see the results, see how well I did. Takes a while to calculate going on. Oh, I passed. Damn, I'm good at this. The score is 26 out of 39. So like this, the total number varies depending on the type of questions I get. So if I get true or false questions, that's like each true or false question has 5 points, and each SBA, like single best answer question, has 3 points. So if you get more true or false answers, like true or false type questions, then the total score is higher. So yeah, it's calculated like that. Average score is 0. Okay, this nobody has done this before, so that's why it says average score is 0, and this value will change after when I do it next. So yeah, so when you restart it, it will give you a separate set of questions because this is randomized. Yeah, so it refreshes the page. This is Oh, it's giving the same question again. I mean, there's a chance that out of the 500 questions, I'm getting the same question twice. Let's just put something. Oops, that was too loud. Next. First line treatment in the... This is a different question, but again on schizophrenia. I mean, clozapine. Clozapine is a very commonly questioned high yield topic. So yeah, that's basically it. So I'm not gonna go through the same questions again. Demonstrate that the questions are different the second time around. This is what I wanted to show. And yeah, other than that, what I wanted to show you guys is this. When you click the, okay, this part is here because I'm the admin of the website, but here you can see your account. So when you click that, I'm gonna leave this because I'm not gonna complete this quiz. Loading. Yeah, so this goes to your dashboard in your account, and here you can go down and check your activity, and that's like this is your MCQ dashboard. So when you get a premium account and do your questions, this this shows up on your account page, my account page, and you can check your activity. So today I did 3 quizzes. So before this I did 1 quiz, and this I completed 1 quiz, and this is the 3rd quiz I was doing. And in this tab you can see your results, like today's results. And it actually shows you, I mean, like this is the last quiz I did. So okay, this last one I didn't do it, right? So it says 0 seconds. This one I stopped halfway. This is the one we just did. I got a 66% mark, and it took 32 minutes. Yeah, and yeah, we started at 7:06:02. And this is one I did before that. I kind of stopped halfway. Same psychiatry quiz. I didn't do it. 0 seconds. And I did surgery MCQ, and I got 55%. So yeah, that is, you can wait. I think this is showing like this because I'm zoomed in. Let me go back to the normal. Yeah, it's gonna show up like this in a like a table format. So it shows you the duration and start date and time they passed or failed or whatever. Okay, this is kind of embarrassing. I failed a few cues, but you can track your progress. How you gradually increase your score, and yeah, you can track your progress like that. So yeah, you like, especially for the randomized quizzes, like these randomized ones, they are gonna, so those you can like track your progress. It's no point tracking the progress on like a quiz with a set number of questions. It's gonna be the same question. Yeah, so these are the features of my MCQ question bank on my website that I wanted to show you. So I want you guys to go and check it out as well. It's really helpful to study these topics and to prepare for the exam, because if you had to do them by yourself, like it would take almost 3 times as much time, like, to individually go through these topics and read them. Yeah, so that's it for today's video. I hope you guys learned something out of this and also got an idea of my MCQ question bank. So you just have to go to medschoolhub.com/MCQs. This is the place where you find all of these things. I'll leave a link in the description if you guys are watching this later on. Yeah, and that's it for today's video. Make sure to subscribe and like the video, and peace.